and welcome back to the Voices of Healthcare Equity podcast and our conversation with emergency physician and vice president of U.S. operations for the Healthcare Alliance for the Equitable World, Dr. Randall Bennett. Welcome back, Randy. When we finished our conversation, you were talking a little bit about your experience doing telehealth in places like the Philippines and how you're able to bridge the physical exam divide and the translation divide, and how you work with the local healthcare worker, whoever that is, to help carry out the healthcare in whatever place you're working. Randy, one of the things that Healthcare Alliance is very much championing is the 1% impact, trying to get 1% of the 13 million physicians across the globe and the multiple million other specialists, such as midwives, dentists, um, therapists, and nurses, to give only 2 hours of their time per year as a minimum to this kind of work. That lets us have 700 hours a day of physician coverage, 100 hours a day of midwife coverage, 250 hours a day of dental coverage to provide to low and low middle income communities across the globe. Now, your experience as an emergency physician with a lot of years of clinical practice, now semi retired, advising the national parks. How easy, difficult is it to fit this into your work, your lifestyle on a day to day basis?
It's really pretty minimal. It involves nothing much more than what you do if you went out, grabbed a hamburger, and went to the movies. I joke with my wife often. I say, "Hey, I'm going to the Philippines." I walk down the hallway, go into the office, close the door, and I'm off. And at any time seeing the patients, it's self-directed. You let them know when you're ready to take another patient. So if you need to take a little break for some water, the bathroom, something, you do so. You want to get up, walk around, stretch a little bit, and then you go back and you see patients. And it's not like people are looking at you going, "Hey, you're not keeping up," or "You're not seeing enough patients." It's a completely different atmosphere from working. It's just whatever you see and whatever time you spend and whatever questions you want to ask. It's all good. And so it's very satisfying from that standpoint. Earlier too, you mentioned the language, the potential language barrier. The other thing that feeds into a little bit of the local custom, and so sort of understanding how people live their lives in an area. And a lot of times, I can get that sort of in the call and in a conversational way, and just say, "Well, what's the weather been like recently? Has it been exceptionally rainy? Has it been exceptionally dry?" And these sorts of things where you can have a little bit more of a conversation with people to build a little rapport during the time that you're on the call with them. But it can also give you, of course, valuable information. Is stuff blooming? Is it dry and dusty? Et cetera, et cetera. And then sometimes I just ask and I go, "Well, is there malaria going around? Have people had a lot of malaria lately?" And because, as malaria symptoms can be anywhere from, "Well, I'm kind of achy and I have a stomach ache," to full blown ague. But it's pretty interesting when you work through it like that. But in terms of fitting it into your lifestyle, it's kind of a non-event. You put it on the calendar and you go, "I'm going to give 2 or 3 hours of my time," and you sit there and sip on your Pepsi and chat with people and do all the fun parts of medicine. It's a great gig. I'm very pleased to do it. I'm just really happy that you thought to call me.
We're super excited to have you on our team. Um, And this is an interesting idea. I love what you say about how you feel doing it and having the best parts of medicine, because we do live in a time now where burnout in healthcare is a very, very big topic, and everybody is um, addressing burnout in lots of different ways. Some people are walking away from medicine because they feel that's going to help with their burnout. Some people are cutting back on medicine and working part time. Uh, some people are doing things like relaxing and meditation. And when you talk about, hey, we'd love to get you to volunteer to do this international work, people might say, look, we're already burnt out. We can't do any more. My contention is this brings back the joy, the hope, the control over how medicine is performed that gives you the fuel to continue to be the professional you always wanted to be. Randy, what are your thoughts on how do you carry this out in an environment where people are burnt out?
Well, if I were still working full time, I'd have to be honest and I'd say I'd rather do the telehealth work than I would my day job, just for the reasons that we've already discussed. And, my wife has an interesting saying that she often uses, and it's a change is often as good as a rest. And so when you have the opportunity to go and see patients in a different way, in a different venue, where they genuinely appreciate what you're doing and you feel like you're contributing something to them, uh, uh, it's it's pretty easy to do. Um, if you think you're overtasked and burned out and don't want to do anything else to do with medicine, I would still urge giving it a try. And I really think it'll help you connect back with the basics of medicine, where there's you and there's a patient, and you're genuinely trying to help them. That's the sort of feel that I get from it.
And Randy, you, as so many things, you lead by example. And when you talked about what kind of things you used in those situations previously, you talk about how you speak to the patients with curiosity, you speak to the people on the ground with curiosity, and you learn things about the situation and the cultural context. I do think that is also one of the takeaways for people that do this kind of work. There's an incredible amount of learning that one can do again in a very exciting way about how this care is carried out in different parts of the world. There's collaboration that you can do with people from all over the world. And how do you change or tweak what needs to be done for the cultural competence, for the context, for what's available? I find that kind of changing things up, learning to do things in a slightly different way, actually very enlivening and enriching. What would you say about that?
Well, it's a pretty rich world out there when you look at it. One of the things that I appreciate being able to do now, more than I'm semi-retired, is a lot more travel than I did when I was working. We all remember the vacation penalty, where you work like a dog till you go on vacation, then you get there exhausted. Then when you come back, you work like a dog again. So you've essentially undone the value of any vacation. But doing this, you're right. I mean, you get a little insight into the culture there, into how people live their lives, what their concerns are in terms of their health care. Because we always know that patients oftentimes will have sort of an unstated agenda when they show up, and it's not that they're there for arm pain or cough or this or that. They have a deeper concern that's behind that, and sometimes they're even fearful to voice it. So, there's a lot of cultural sort of read in that has to go on there. So it takes a little to tease that out. And the way that I like to do it is by establishing rapport through just a kind of everyday conversation. Like, what's the weather been like? What's your work schedule been like? Have you worked any overtime? And, that sometimes sparks a little conversation about their workplace. And they go, well, It's not well heated. It's not well cooled. It's this, it's that, it's the other. Here's the sort of work I do. And, a couple times I've asked myself, well, I'm not familiar with that. What does that entail? Are you lifting things? Are you? So it's kind of a little glimpse. I won't say it's as good as going there, but it's a little glimpse into how they live their lives and what goes on there. And I enjoy that a great deal. You know.
And certainly, we have so much that we can learn by collaborating across our borders internationally with healthcare workers all over the world. I know that when we pick up a new site, I always do some learning and research. What are the most common diseases that are going on? How do you treat that? How does it present? What is the environment like? How do people live? Do people have burning wood in their home? Do they not have it? That has a big impact on the respiratory illnesses they might present with. So what's really exciting is the learning and the curiosity and the making your lens and perspective that much bigger about healthcare. Okay. Randy, where do you see an intervention like the Healthcare Alliance for an Equitable World making a difference as we grow?
Oh, I think it sounds cliche, but I think literally the sky's the limit. I mean, you can have such an impact here with so little effort on the part of a physician. The major chunk of this is literally bandwidth. If you can get some sort of internet connection to a village or a region, and if people can travel a relatively short distance to that area, you can. In the military, we call it something that's a force multiplier. So it takes one soldier and through technology and other assistance makes him the worth of 10. So here, the internet is a force multiplier for the physician. So and the idea that you can come this month and maybe even once or twice in the month and then come back the next month and once or twice there is terrific. I mean, I cannot overstate the value of that. It is tremendous. So I'm really kind of surprised that actually, we've been so engrossed in telehealth, during COVID in the United States. I'm really kind of surprised that nobody else has sort of picked up the idea about doing it internationally because it's, as I mentioned earlier, it's pretty easy. You walk down the hall to your office, sit in your own comfy chair, and you go to the Philippines.
So I am not all that surprised, Randy, because I love that you said you had this head banging moment where you're like, wow, this is high impact. It's useful. It speaks to me. Why didn't somebody else think about it? I think the reason is because we have to bring the solutions. We, the healthcare workforce, have to be the thinkers, the leaders, and the innovators, and not wait for some other magical person to come along and tell us what the solutions are. Because they will, but they won't be this very sharp tool to get to the answer that only us with our experience can see. And I do think that that makes a big difference. So I would encourage more clinicians, more doctors to put themselves in a position where you have an idea about how to improve healthcare. Your idea is as good as and is better than most because it's informed. It's informed by your actual experience in the arena. One of the things I love about this is it makes it more accessible to more people as well. So if we can get 1% of the global healthcare workforce to do it, we can get 10%, we can get 20%, we can get 40%, we can get 80%. 15 million healthcare worker shortage in the world. And more than 75% of those healthcare workers are only working in the Americas, Europe, and Australia. So the great majority of the global south is not getting the benefit of the 13 million physicians and other healthcare workers that still exist. We could wait several generations to grow more doctors, but that's not really what somebody that needs healthcare right now in a village, in a rural community wants to hear, right? We can't help you today. We can help your great great grandchildren, maybe, if we just wait and do things the way we always did. But with this intervention, we can make a real impact in this lifetime. We can actually do it in just a few years.
No, I agree with you. I mean, this is just a golden opportunity to to be impactful. Uh, and a lot of times, I think we're all familiar with the concept of the worried well, and they're probably the least satisfying group of patients that we see. Patting somebody on the head and going there, you're going to be okay, is not always that satisfying. But we're talking about people where early intervention might prevent them from being disabled. In a third world country where disablement is just one step away from death. So it's the impact that you can have is pretty amazing, and it has always impressed me. And you're right in terms of trying to train people to meet that need. Let's get real here. That's not going to happen. There's no way that we can interest that many people in healthcare and get that many people involved in a short period of time. You've got people here that are, as you pointed out, underutilized. They've gone through and now they're working half time. So yeah, geez, if you're working half time and you're satisfied with that, that's great, I suppose. But the other thing is I always looked at my career as a physician and realized that I had been propelled, if nothing else, or assisted in getting where I was by the efforts of many other people, whether they realized it or not, and whether or not that was assistance with tuition that I received from the GI Bill, which was a payoff for my government service, or whether or not it was loans or grants that I received. I always felt as though I had a duty to practice and to practice as much as I could to pay back the societal debt. And I'm not necessarily I wouldn't bill myself as a hugely socially conscious individual, but I think in that sense, I realize that with great abilities go great responsibilities. And so if you have the ability to help people, you need to do so. And this is one way to do it. So if you think you're burned out or don't want to work full time or you're just not that interested, that's great. But for a few hours, come on, think of what you could learn. I think I think everybody should do it. In fact, you and I had a discussion a couple of weeks ago uh, about a friend of mine who's in a nurse practitioner program, and I wanted to sign him up so that he could go on these calls with me. I think it's an incredible learning opportunity for students. I know the two students I took to Ghana, they were terrifically impressed by what they learned there and came away with a terrific understanding of what it's like for people who can't get the health care that they want. So, and I didn't say need, but want.
Absolutely. We're creating the future that those medical students and residents will be living in. And we certainly can be the vehicle for making their introductions to how this work works, why this work is meaningful. And we're actually in discussion right now with a group in the Eastern Cape of South Africa about having their postgraduate residents work with us. So, very important is bringing that next generation on board as we move and scale this intervention. I know you have been a big proponent of medical education when you ran the emergency department in at the Tucson VA. Randy, how can someone connect with you in our audience if they have any questions about this work or interested in asking about your experience?
Well, there's of course the HAEW website. You can go there. Um, you can, anybody who wants to can contact me directly. It's not like my email has a VPN associated with it. I get, judging by the amount of junk mail I get, I think I must be number one on everybody's list. But I'm happy to hear from anybody at any time, either by phone or email, and chat with them about it. So if at the end of your podcast you want to make that available to them, I'm fine with that. And I'll talk to anybody about it, answer their questions. And, yeah.
Anything you would like to add before we wrap up this amazing conversation?
I would just do it. The investment of time is trivial. The enjoyment that you'll get from it, I think, is something you've probably not experienced in a long time. Try it out.
Awesome. Thank you, Dr. Bennett.
Sure.
In this episode of our podcast, we've explored the need and potential to meaningfully and massively expand the availability of fully trained physicians through our alliance. If you're retired, semi-retired, medically disabled, burnt out by the current healthcare system, or just care about being a part of creating a more equitable healthcare future, please join us. Go to https://haew.org to learn more, volunteer, join us, or donate. Listeners, we need your support too. Please share today's episode with a friend, leave us a review, share your thoughts. And if you're interested in being a guest, please email us info@haew.org. Let's amplify the conversation for a healthier and more equitable world.